Hi, I'm Carrie with In Motion OC Physical Therapy in Irvine, here to talk to you about a common injury, plantar fasciitis. This is an injury that usually you feel at the bottom of your foot. It usually is worse in the beginning in the morning when you first take a first couple steps. It gets better as the morning goes on and then gets worse at the end. It's very common for people that do a lot of weightlifting or running. So a lot of things where you have a lot of pounding on the bottom of your feet. It can be caused because the plantar fascia, which is this ligament that goes along the bottom of your foot, is too long or too short. So we have a couple exercises for you just to help with this injury that we'll go over right now. So this exercise we're going to do it's called the calf stretch. So the calf is made up of two muscles, the gastroc and the soleus. So the first one for the gastroc, you can use a step or a stair, anything that you might have at home. But you want to be able to have your heel come off the end, okay? So the key for this exercise is you want your knees straight and you want your toes in front of your heels. So when you do this, you should feel it more in the gastroc, and that's this area right up here, okay? So when you're doing this, hold it for 30 seconds to a minute. Make sure you get a good nice stretch. After that, to work more of the soleus, you want to bend your knee. Same thing, toes in front of your heels. This one you should feel a little bit lower. So it should be back here, okay? So the key for these stretches is you want to be able to hold it for 30 seconds to a minute, and you want to be able to feel it where you're supposed to without any pain. So once again, these are called the calf stretch. Okay, so this next exercise we're going to do is called windshield wiper. So what this does is works on some of the muscles in your feet. So for this one, you're going to sit up nice and tall. You're going to have your knees even with your hips. So you don't want them to come in, you don't want them to come out. Your knees are going to stay stationary. So a good way to make that happen is you can put your hands in between. Okay, and the point of this one is you're going to move your feet in and out. Okay, the goal is to not just move your feet like this. You want it nice and controlled so your muscles are working correctly. So actually your arches should increase a little bit, and then they should go lower, okay, as you go back and forth. So when you do this one, do it 10 times, and you're going to do it 10 repetitions and 2 times each time, okay? And these are called the windshield wipers. So this next exercise is called towel scrunches. So it's going to be exactly what it sounds like. You're going to scrunch the towel with your toes. So this works on some of the really tiny muscles that are on the bottom of your feet. So all you're going to do is you literally put a towel down, okay, and you're just going to try and scrunch it. And you're going to do it so that you go all the way to the ends. And you're going to do each of this 10 times, okay? So just like this. So once again, these are called the towel scrunches. So the next one we're going to do is a single leg balance, okay? This one's a really good one to do around your house. Say when you're washing the dishes or when you're brushing your teeth. It's literally you're just standing on one foot, okay? The keys for this one though, you want your knee not super locked out, but you want it just bent a little bit, okay? It makes it a little bit more stable. Steer straight ahead, and you don't want your hips super down, you don't want them up, you want them nice and level, okay? So for when you're trying to balance, try and hold it for 30 seconds to a minute on each foot. So once again, this is called the single leg balance. So for the exercises we just did, this is a generalized program, so it doesn't take in consideration your individual differences, such as I said in the beginning, whether or not your plantar fascia is too long or too short. So if these exercises are causing more pain, go ahead and stop what you're doing and seek further evaluation. But some key points about the exercises we did do, make sure that you're doing them with good shoe support. So make sure there's a good arch support, good cushioning on the bottom. Try and decrease the amount of running that you're doing or exercise you're doing on hard surfaces. And then also make sure you stretch, because it's very important for this one. And if you're interested in physical therapy, this is an injury that's usually covered under insurances, so feel free to contact us. Our website is inmotionoc.com.